Good morning, good afternoon, good evening. I'm Wanda Curley, your authority on project, program, and portfolio management. This is brought to you by PM Powered, your consulting company on project, program, and portfolio management. Before we get started, I've got an announcement to make. This will be my last podcast. I've decided to take a break from doing podcasts, and hopefully you'll find all the ones that I've done previously to be good for you to look at again. So without further ado, let's get started. The first thing I have to do is robots, and I always am intrigued by project managers that work in this area. This is a robot that looks kind of like a dog slash a panther, I guess is what I want to say. But it's amazing. It can walk sideways, and it has a camera on the front, back, and on the sides. It's to help provide security in an office environment. But it also can pull. They had several of these pulled together like in a sled motif, like you'd have sled dogs, and it was actually pulling a truck. It was absolutely amazing to me to see this. And so this is coming from Boston Dynamics, and they call it the Spot Mini. And then they also are planning on having all kinds of other robots to handle different things around the companies. Of the Spot Mini, they plan to do about 100 by the end of this year. And they're, like I said, they're being tested to do assembly line work. They're tested to be robots in the office place. They're supposed to be robots to help pull hard things. So that'll be amazing. So stay tuned and watch Boston Dynamics and see what they do, because to see the films that they have, the videos on their robots is just absolutely amazing to me. So let's go to the next one. This one to me is the future of transplants. So it's called How Scientists 3D Printed a Tiny Heart from Human Cells. So I don't want to get into all of the mechanics of this, but the scientists were able to pull apart the different fragments that make a cell and take the cell part that they needed to do a 3D model of a heart. And they actually took this cell, the part of the cell, and they put it in a 3D printer, and the 3D printer printed a heart. Now, it was the size of a rabbit heart, so it wasn't a full-blown heart. But it had the 4 chambers. It had all of the veins and arteries that were needed. It had the veins going in and the arteries going out of the heart, plus the vascularity that is around the heart. And they put this into a nutrient-based liquid that also had oxygen in it. And when it took several hours to build the heart, to do the 3D mapping of the heart. But in several days after being into this nutrient fluid, the cells started actually firing off like a heart. Now, it should be noted that the firing of the cells was not done in rhythm like our hearts do. So there's a lot to happen before we can actually print an actual heart. They did say that if they were to print a heart the size that is needed for a human, it would take several days, and the cells would start dying, the ones that were printed earlier. So they still have a lot to do to figure out the technology. And they also have to make sure that it's with full cells that look like heart cells. So there's a lot to do, and they've got to make sure, that the heart cells fire in the way that they need to in electrical base like we do in our heart. So stay tuned. I don't think it's around the corner, but I think it's coming. So if they can manufacture a heart with a 3D printer, think about all the different things that they can do. So people that needed heart transplants would be able to make a heart from their own cells. Think about people that have diabetes because their pancreas doesn't work well. So they could replace their pancreas with one that produces insulin. Think about livers. People that have liver cancer, they can take the liver out and manufacture a new liver. So this is just amazing to me that this is capable of doing. And I'm sure we need to look at this in the future. So let's now change gears a little bit, and let's go to what happened in France. I'm sure you all heard about the Notre Cathedral, which is kind of the mainstay and one of the premier tourist spots for Paris, France. It burned down last week or the week before. I shouldn't say it burned down to the ground. The stone structure maintained, but the roof, which was made of wood, hundreds of year old wood, burnt to the ground. So there was a pioneer architectural historian, and his name is Andrew Tallon. He actually died of brain cancer in 2018, and he was 49, so he was very young. But he actually took a laser and mapped out the whole Notre Dame, including all the different architectural creations that had to do with the roof. He took all the things that had to do with buttresses. He took the things to look at exactly how the organ was placed. And so he put it in 50 different places. It took laser image photography of Notre Dame. So they're saying that they're going to be able to take this 3D, it's actually 3D of how Notre Dame actually looked before the fire. And whoever is hired to do the actual reconstruction of the building will have these 3D architectural drawings that they can look at to be able to, excuse me, to be able to actually rebuild Notre Dame. Can you imagine that, being a project manager and be able to see actually how Notre Dame looked before the fire, and they can manipulate it and rotate it and see what they need to do. Now, it's known that they're not going to be able to put the same beams that they had before, because these beams came from hundreds of year old oak that was in France, and they no longer have that. So no telling where they'll get the beam structure from, but it'll be interesting to see how they do this, because they need to make it look as much as they can like the old architecture. Now, granted, it'll be new architecture and it'll have to meet some codes. So that'll be astronomical to see how they put in the new codes with the maintaining the actual flavor and feeling of Notre Dame prior to the fire. So let's go to the final thing that I want to talk to you today about, and it's about AI. You know, I like to talk about AI. So this one is about AI in healthcare, and it comes from Singularity Hub, and it's called How AI Can Tap into the Collective Mind to Transform Healthcare. So this was actually a bust for AI. And in 2013, IBM sold the University of Texas MD Anderson Cancer Center on an audacious idea that a single AI-powered platform, IBM Watson, could lend a digital hand to battle one of mankind's most abominable diseases, and that's cancer. Well, guess what? It fell apart. Yet even as Watson stumbled, it provided valuable insight and a powerful peek ahead at how machine learning technologies could one day supplement and revolutionize almost everything doctors do. So while it stumbled on trying to find the cure for cancer, it did show how AI and doctors can work. So think about reading X-rays and reading CAT scans and PET tomography. So AI is very good at that. In fact, it did much better than a radiologist, well-known radiologists who have read these X-rays forever and ever and ever. Watson was able to do this in a more proficient and more accurate way than these world-renowned radiologists. So it doesn't mean that the radiologist is substituted. Absolutely not. You still have to have that human in there to verify that what was done. So what could happen, and as I foresee it in the future, is that AI actually picks out those that screen positive for something, and then the radiologist would read it and make sure that they agreed with it, or go back and see why the AI picked it as being positive when they think it's not. And from this, the AI can actually learn. So if it picks out a positive that's actually a negative, it can actually go in and update its rational thinking and be able to now put this into its database. Now, we randomly will have to look at negative results, because there might be some positives in that. Just like with radiologists today, they sometimes call it a negative when it's actually a positive. So that will have to be looked at as well. And from that, AI can learn as well. Then we have diagnostics to treatment. So these, as I was just talking, they can see potentially lethal lesions on mammograms, diagnosing skin cancers, retinal disease, so they can see it of the eye, and maybe even some psychiatric symptoms, or learn to make recommendations for referrals. That would be an algorithm that could actually work very well in it. So how could healthcare overall be helped with this? So diagnostics is just at the tip of the icebergs. Think about when you go in to see the doctor. He is probably standing at his computer or taking notes, and he's doing it furiously because there's so much paperwork that has to be done when treating a patient. And that's just what you see. Behind the scenes, there's a whole bunch more. So if you need to have extra diagnostic treatments such as x-rays, CAT scan, PET scan, et cetera, or physical therapy, there's even more paperwork. And then if you need to have a prescription, the doctor has to write even more paperwork. Now, it might be done electronically, but it's still paperwork as we do it. So what can happen is that the AI can help the doctor go through the steps of diagnosis, so that the doctor doesn't do it through his head, but he can see it right there on his screen on what the next thing should be. And AI can actually help diagnose what's going on based on what the doctor inputs. And so that would be something that would actually really be helpful for doctors, because they could speed along the process. One of the things that insurance companies want is that the doctors see more patients. It's possible that with this AI diagnostics that could be done. But what are some of the stumbling blocks? Well, they call the hiccup that illustrates both AI and the medical community face multiple challenges as they learn to collaborate. It's called the Theranos fiasco. Further paints a painfully clear picture when handling patient health. The Silicon Valley dogma, move fast and break things, is both reckless and exceedingly dangerous in the healthcare system. You can't do that. So we have to be careful how we put AI into the healthcare systems. So medicine particularly highlights the limits of machine learning. Without assembling a representative yet diverse data set of a disease, for example, AI models can either be wrong or biased or both, and that's what they found with Watson when it was trying to find cancer. This is partly how IBM Watson crashed. Creating a sufficiently large annotated data set to uncover yet unknown medical findings is exceedingly difficult, if not impossible. Remember, AI needs to have data, and if it's something that has never been seen, most likely Watson or any AI would have difficulty bringing it out into the open. Yet authors argue that it's not a permanent roadblock. AI models are increasingly able to handle noisy, unreliable, or variable data sets so long as the amount of data is sufficiently large. So you can't just give it 2 and 3 data sets. It's got to be multiples of hundreds of data sets, thousands. Although not perfect, these models can then be further refined with a smaller annotated set, which allows researchers and clinicians to identify potential problems with a model. So it's be interesting to see what we're going to be doing in the future. So tiptoeing ahead, what do we see ahead for AI and healthcare? As Watson painfully illustrated, overhyping the promise of AI disrupting healthcare isn't the best way forward. And I never thought that was the best way forward. You still need all the knowledge and value set that doctors and clinicians and researchers bring. Rather, the authors are carefully optimistic, expecting a handful of carefully vetted early models to appear in the next few years, along with a cultural change driven by economic incentives. As I said, the insurance companies are driving this, and the ideal value of healthcare for all. In the end, machine learning doesn't take away anything from the doctors. Rather, a physician's warmth, her sensibility, sensitivity, and appreciation for life will never go away. It will just be supplemented. And that's what I said. It helps with the diagnosis. it helps maybe do some of the back end paperwork that needs to be done. This is not about machine versus human, but very much about optimizing the human physician patient care by harnessing the strengths of AI, said Cohen. So this is all that I have to bring to you this week, but I hope over the 67 podcasts that I've brought to you over these last few months brings you a lot of learning and a lot of knowledge and the ability to deep think about what disruptive technologies will bring to project management. Because think of AI in healthcare, it can also bring disruptive technologies to project management. Think about the billions and billions of dollars that we spend in project management. And there's even programs out there that are in the billions of dollars. If you could have AI helping you, it could be disruptive to the technology and actually make you a better project manager if you know how to harness it. So I'm Wanda Curley, your authority on project, program, and portfolio management. It's been ideal bringing all this to you. This was brought to you by PM Powered, which will continue, by the way, PM Powered, a consulting company in project, program, and portfolio management. Please go out to PM Current and follow me on YouTube, Twitter, Facebook, and LinkedIn. I'd love to have you follow me and see what I bring up next. Maybe I'll be bringing to you blogs in the near future. I hope to see you soon. This was a delight, and take care and be blessed.